everyone, welcome to the last Be Live of the year. Be Live has been a series that we've been running since the middle of this year, so I think since July. It's a series where we look at BME health inequalities and we discuss different topics every month. This right here is a pre-recorded session and it's taking a look back at the work that the team have been partaking in with HIV prevention during this COVID-19 pandemic. I'll be asking my fellow prevention team members at Positive East to reflect on this year and to give you a taste of what's been happening and what the future holds for the HIV prevention response. Firstly, I'd like everyone to introduce themselves. So I'll start with Euriza.
Hi, my name is Euriza. I'm the new GMI HIV prevention support worker. So I just joined the team.
Fantastic. And Badru?
My name is Badru. I've been working with Positive East for over 2 years now, maybe. And yes, I'm the prevention and testing coordinator for Positive East, mainly focusing on Black and ethnic minority groups. My work involves a lot of networking and engaging with communities from different backgrounds. So yeah, that's me, Badru.
Thank you. Massimo?
Hi, I'm Massimo. I've been working with Positive East for the last 2 years. At the beginning, I was HIV prevention and testing coordinator for the Red Bridge area for the LGBTQ community. But now with the COVID, we overhauled everything, and now I am an enhanced need outreach lead and volunteer lead. So basically, I will coordinate the outreach face-to-face when we will be able to go back to it. And in the meanwhile, I help managing the volunteers of the prevention and testing team.
Thank you. And last but not least, Yasmin.
Hi, so I'm Yasmin. I am the Interim Prevention and Testing Team Manager. I worked at Positive East for 3 years, from 2016 to 2019. And then again, I came back on an interim basis to support the team during the COVID-19 lockdown to try and strategize about how we deliver HIV prevention when we're not allowed to actually see anyone face to face. And it is a privilege to be back working with you guys.
Thank you, Yasmin. I've just realised I forgot to introduce myself. And my name is Gloria and I am also a testing and prevention coordinator, leading on team trainings. So what I'd like to go into first is just a quick discussion on how have we been delivering HIV prevention services during this pandemic. Badru, would you like to start?
Oh yes, because of the COVID-19 pandemic, it has been quite difficult to provide our services face-to-face, following all the standing operating procedures as given to us by Public Health England. So we had to reimagining the way we provide our services in a remote way, in which we will have to put in place all the procedures given to us and for prevention of COVID-19. So in that case, we had to suspend the face-to-face, and we have our HIV testing in communities provided remotely, and our outreach services also provided remotely, and also our engagement with the communities and training remotely. So it has been really a change, a big change in the way we provide our services, comparing to what we used to do in the past.
Thank you, Badru. And Yasmin, would you like to tell us a bit more about the new model that we're using when we're partaking in HIV prevention?
Yeah, so this COVID-19, we had this kind of whole redesign of our team. which is why Massimo, when he introduced himself, he says, I used to be the Redbridge coordinator, now I'm the enhanced need outreach lead. Part of that was trying to work out what's the safest way to deliver a service. Obviously, as Badru said, we now do a remote service, so we can provide people at home with an HIV test, and we provide video consultations and phone consultations. But a piece of work that Massimo is leading on was doing face-to-face outreach still with those who are at highest need. And that was working alongside some of our NHS partners, including UCLH, which is the TB outreach team, tuberculosis outreach team, in the homelessness hotels. He can tell you more about that. So it has been a challenge, but the team has risen to that challenge in an amazing way.
Thank you, Yasmin. Yeah, Massimo, if you could tell us a bit more about that, and if you could also talk about any challenges that you've seen with the new services that we've been offering.
Sure. So yes, as Yasmin said briefly, we have been doing a little bit of face-to-face outreach in between lockdowns, and that was dedicated mostly to people with enhanced needs, meaning that had more difficulty accessing the remote service. So the majority of the work that we were doing before we had to forcibly interrupt it was partnering up with other organizations that were already doing testing for other reasons, like UCLH that was testing for TB and offering a wide range of bloodborne viruses tests. So beyond TB, they started offering also tests for HIV, syphilis, and hepatitis B and C. And that's where we were called in to help out with the creating some awareness about HIV and offering support with referral pathways for those who will test reactive for any of the sexually transmitted infections, and particularly for HIV, we will refer the reactive results to our peer support to be assessed and introduced to positivist services. And yeah, that's what we have been doing for a few months, from end of April until the end of the summer, more or less. And that's what we are planning basically to do when we will be able to go back to do face-to-face testing. Challenges for in particular for the face-to-face during COVID is, of course, the adoption of the PPE that is needed to protect ourselves and the clients, because, of course, we are testing for other things, but we still have to be aware of COVID-19, and we have to follow guidance so that we avoid we reduce to minimum the risk of infection for us, ourselves, and for others as well. And yeah, it is quite challenging to communicate through a mask and a visor and wearing what I call a butcher apron. It doesn't really inspire confidence to others. But what I do, I always try to connect with them, as I always do, and usually that's what is important for them. For the online testing, which I am taking part in as the rest of the team. The challenge, first of all, was the different approach. Of course, we are not there providing the testing firsthand. We just have to watch somebody do it on themselves, and it's a bit frustrating probably at the beginning to be there looking at them and see that something is wrong and we could do it faster and help them better if we were there, and we are not. So it's a bit frustrating, but I think it's minimal, because anyway you see a lot of gratitude from them afterwards, and the little suggestions that you give them, the little tips that you give them to do the test effectively, is like it looks very small to us because we do it every day, but for them it's like a discovery and something like, oh, they are always like very thankful. Oh, thank you. I didn't know I should do this. It's very helpful. It helped me a lot. So we usually get, it's frustrating maybe from one side, but on the other side, afterwards, their gratitude is quite like fulfilling, and you really forget the frustration afterwards because you have been able to help them.
Thank you, Massimo. Euriza, I know you're relatively new to the team, but is there anything you've identified, being as part of the team, as anything you can see as sort of a disadvantage or an advantage to the new services? It could be, when we're talking about the remote testing, or it could be like our online services. Is there anything that you've seen that you'd like to mention or highlight?
I would say it's more about getting everyone involved again, because not everyone has the same access to, like, let's say, online services, and not everyone is how can I say, they have the confidence to use like technology. So, and if we, like, by developing this service is also an opportunity to get everyone involved, even like in my case, trying to get more the migrant communities also involved in that new format. So yeah, it is a challenge for everyone. So but hopefully we're going to get there.
Yeah, thank you. No, it's true. I mean, I think all of us have had challenges, but I think we've seen it's been beneficial. I know from my viewpoint, working in training, it's been fantastic being able to reach so many more people. We've been doing training, I mean, all over London, and it's fab because I can do it from the comfort of my own home. I don't have to worry about how long it's going to take me to travel there. I don't have to worry about how long it's going to take me to get back. And you can run training more often, more frequently, without worrying about logistics and things like that. Yasmin, did you have anything else to add on to that?
Yeah, I mean, I think in all areas it's kind of enhanced the work as much as it has been a challenge. So, like, for example, this series, Be Live, we wouldn't have started this if it weren't for COVID-19. Massimo runs Technicolor, which is an LGBT film night, and it used to run in Redbridge and Ilford Library, and now he's moved that online, and actually now, like, the reach of that has really expanded. So there has been like some real benefits to being able to work online. At the same time, like Euriza is saying, when you were trying to target like more vulnerable communities who may not have access to digital tech or be as confident using it, we are worried, of course, and we're always constantly thinking about how we don't leave people behind. And that's part of Massimo's role, is as the enhanced need outreach lead, to make sure that those people aren't left behind. So for example, with our remote testing service, we started on the 14th of July, and since then we've tested 119 people. Normally in a year we test 3,500 people. So it's kind of like a tiny number compared to how many people we would normally see. But at the same time, each of those people that we test, like they come into the service, and then you talk about sexual health. They do a pre-test consultation, and then you send off for the test, and then you do follow-up, and then you do coaching, and then you do the results giving and waiting for STI results and things. So even though it's 119 people, it's more like the amount of work of 400 to 500 people, just to make sure that everyone's followed up, and that they're confident and that they're comfortable with the process. So the other piece of learning as well has been like how to monitor people and make sure people aren't like falling off, like we say in the HIV world, they're not lost to follow up, because what we don't want is to be sending out HIV tests and then not being able to provide support when people get the responses. So that's one of our key priorities. But so there's been lots of learning, but also it's been challenging, but it has been amazing how I think the service has adapted and how you guys have adapted that service.
Thank you, Yasmin. So Badru, when we're looking at the new services that we're offering, have you seen any issues, especially in the BME community, that you can see, like any issues with the clients that are coming through?
Regarding community engagement, it has been an issue of people, as Euriza said, who are not used to using technology, or those who do not have access to Wi-Fi and things like that. So because we deal with a very complicated community or population, these are the most deprived ones. You find that a big number of them do not have the technology, laptops or smartphones to engage with us. The other challenge has been with testing. HIV is highly stigmatized, and people are very, very cautious about giving out their details, which we really need to be able to test them, to engage with them, to make sure they, get full service of which we can provide. So if they don't provide us with the details, their proper details, then we are unable to do that. Those have been real challenges in our work.
Yeah, no, I totally agree. I mean, it's been really interesting because obviously with the Be Live, we've been able to reach more people and have interesting discussions. Like when we, was it last month? I think we had the discussion around PrEP use in the Black community, which was a very important discussion to have. And I often find when I have clients who can, who present and maybe they're regularly engaging in, in high risk sex, the topic of PrEP is always one that's, it's a bit of a prickly one. People don't often, they're not quite receptive. I don't know, sometimes it could be because of a lack of knowledge around PrEP or the stigma that's attached to using PrEP, but I find that's one of the issues that I have when discussing it. But I think that's why this whole period of COVID-19 could sometimes be seen as a blessing in disguise, because it's allowed us to rethink the way that we get information out there. And it's allowed us to have, on that panel, we had people from, we had someone on the panel who was living in Manchester. If before, we wouldn't have been able to have that conversation because we'd have been thinking, how much is his train ticket down here and things like that. So yeah, no, that's definitely beneficial. Massimo, when we're talking about, the way we've had to change our services, how do you think sexual health clinics have changed, or what can you tell us about the way sexual health clinics have changed?
Well, of course, everything in the NHS realm has had to be changed because of COVID-19. So this affected sexual health as well. And of course, clinics can't see people face to face as much often as they were doing before, and probably a lot of our service users saw that firsthand. Going to the hospital even for medication and things like that is much more restricted, and made it as little as possible. So sexual health clinics had to deal with this, and as a result, they are not able to provide face-to-face testing to everyone who wants it. because they have to prioritize people who have like serious symptoms to restrict as much as possible the possibility of COVID infection. So a lot of our service users probably found out in the hard way that especially during the lockdown and a little bit afterwards, even though if it got a little bit easier, but it was extremely difficult to get a face-to-face appointment, if not impossible, unless having severe symptoms. And everybody was directed to the SHL self-testing kit, which is a great service, but not everybody is able to use it. We identified a few problems with that, and that's why our remotely assisted system came out, because there was quite a big part of the population wasn't able to use that service for various reasons, because as we were saying before, their vulnerability status wasn't allowing them to access the internet, or because of language barriers. We have a huge population in London where English is quite difficult for them. And in order to order a self-testing kit online, you have to have quite a good knowledge of English, otherwise you are cut off of that service. So it obviously COVID created a lot of problems in the sexual health, in accessing sexual health clinics. And that's why we're doing whatever we can to supply some kind of relief to this situation.
No, totally. I totally agree with everything you said. Yasmin, I know you're interim at the minute, so you're planning on leaving us soon. But moving forward, how do you picture our services being COVID-19 appropriate, or making sure that we're COVID-19 safe moving forward?
That is a big question. I think one of the things to note with the new services we've designed, and especially with the remote service, is we are finding that there are some groups, like with our Black and minority ethnic groups, who may not be accessing the service as much as would have before. At the same time, there are still within that population some younger groups who are accessing this remote service and who actually we wouldn't have seen in our face-to-face clinics. So although we are missing a proportion of the need, the remote service has opened up a whole new area of need that actually we perhaps wouldn't have even thought of approaching were it not for COVID-19. So it's not just the case that, that we're not saying that BME groups can't use remote services. Actually, there's different levels of need, and that's what we're finding with these services. So definitely want to continue with the remote offer. We're going to have to, I think. I don't know when this vaccine is coming for COVID-19, but we are going to have some type of remote service built in. We have done a full risk assessment. We've done risk assessment with staff. We've done PPE training. So we are committed to providing a face-to-face service again. It's more just a question of when, and that will be when it's safe enough for our staff members, for our team, and for the people that we're serving, so that we don't then unintentionally transmit COVID while trying to prevent HIV. I mean, that would just be ridiculous. In terms of COVID-19 as well, generally what it's done is it's showed just the huge level of health inequality that exists in London and actually globally. We've seen with COVID that it's Black and ethnic minority populations who are disproportionately affected with COVID, and we see the same with HIV. So I think going forward, we have to think more about those wider health inequalities and how, yes, we're an HIV service, but actually we do sexual health screening and we do contraception advice. And actually, in terms of the support we provide for people living with HIV and our service users, we do a whole lot of holistic support that looks at someone not just like through the lens of disease and individual, and takes into account the whole situation. So when we're moving forward and thinking about services, it will be around designing a service that takes into account health inequalities and works more widely, I think, to support people, not just to stay free from disease, but actually to live healthy, fulfilling, you know, sexually active or sexually fulfilling lives. So that, I think, is, maybe it's a bit intangible, but that's kind of our commitment going forward.
Thank you, Yasmin. Euriza, I know it must be hard. Well, I can imagine it's hard joining a new team in the middle of a pandemic. What challenges have you found with joining a new team? So, I mean, during this period of time.
I think first of all, is just adapting to all the remote services that we are providing, and also engaging with the community, with service users, who are adapting to this new system. It's part, as Yasmin said, it has been good in the sense, like we have managed to get new people, but then it's also about trying to get on board the Black minority or minority ethnic groups. So it's been a mix. So, but it's good. It's good so far. It has been good.
Yeah,
new experience.
Yeah, I can imagine. I mean, I joined the team at the end of January, so I've been working from home longer than I have in the office, and I can't imagine how it must be joining the team working from home, because I remember when I started, it was really helpful because I got to see everybody. We were out in the community, so it made me I found it easy to familiarize myself with even the landscape of the local area, because I was going out every day. I was seeing. I was in different clinics, but now trying to imagine everything from home, I don't know how you do, but you're doing well so far. We're enjoying having you on the team. You're a great addition to us, and I mean, we just did a training today, and yeah, it was really good. So yeah. So yeah, Badru, how do you think COVID-19 has impacted HIV prevention in general?
It has really impacted. First of all, I should say that when the pandemic of COVID-19 came in, it overshadowed the HIV pandemic. And we almost forget that HIV is still there, and everybody is focusing on COVID-19. In that way, we have really to make our services very visible, maintain importance of HIV prevention, and make sure that people understand that while COVID is there, HIV is still there, and it is affecting communities. Yeah, that has been a major thing. The other thing is that, there are certain things that people don't talk about. It has distorted people's relationships, sexual relationships. Things are happening. People are getting, stressed. So it's affecting their mental health. And sometimes within families, if there is that much stress, it may result into domestic violence. So there has been a lot that has happened. It is something that nobody was prepared for it. Nobody had experienced it. And now it is affecting everyone and every family. So going back to your question, as far as HIV and sexual health is concerned, it has been a big impact. As Massimo said, clinics no longer take on people. People can't just walk in. They have to make appointments, and these appointments are 2 weeks, 3 weeks appointments, and they should have symptoms to be allowed to go to clinics. Some other prevention venues, we cannot meet them. Before COVID, we used to go to homeless hostels. We can't go to homeless hostels. We used to go to communities, to refugee centers, things that we don't do anymore. And you may find that most of the refugees don't have access to technology. People can't use internet cafes anymore. So it has been a big impact. And I think that's why Yasmin said that in a year, we test over 3,000 people, and this time we are trying our best. The amount of people we've tested, and actually people are getting used to our services. So I feel that they will start to access our services and maybe reconvene. Now I'm just imagining also if the COVID pandemic is under control within a year or two or a few months, and we go back to face-to-face services. I think this has been a very good, lesson to us. We've learned other ways of providing a service, which makes it easy. And I'm sure after everything goes back to normal, we'll have a combined way of providing services. I don't think we are going to give up the remote ones. We will leave it as a service while we do our face-to-face services. And that combination way of providing services, I think it is going to be an advantage and a plus to our efforts of HIV prevention.
Thank you, Badru. Yasmin, do you have anything to add?
Just, I think, like you're asking about the impact of COVID on HIV and sexual health, kind of the landscape. We were doing so well with HIV in London in particular. Like there's the 90-90-90 UNAIDS targets, and that's looking that 90% of people who are living with HIV are aware of their status, so they've tested, and that 90% of those people are accessing treatment, and that 90% of those people on treatment have an undetectable viral load, which means basically you're living with HIV, but you can't pass it on because your viral load is undetectable. Whether you're using condoms, not using condoms, you can't pass HIV on sexually. So we had already achieved that in London. We were over 95, 95, 95, and actually like our response was kind of being held up as a model for a lot of other cities. That's part of the Fast Track Cities initiative that Euriza actually here she works on. What we'll have to see is how COVID-19 impacts on that and that HIV landscape, and I don't think we know yet. But certainly people not being able to access sexual health services will have an impact on that. Obviously, Positive East, we also provide a whole lot of support services. So maybe, Gloria, we must ask them how they kind of see what's been happening and the impact on people's well-being and mental health. And just my fear is that all of that good work that we have done, that this pandemic will have set us back.
That's true. Things have changed. It's impacted us in different ways, but hopefully we can take all the positive things that we've learned from this and continue the work, the fantastic work we do as a team towards HIV prevention. So last question, everyone, and this is a question for everyone, so I'm going to ask everybody. Can you tell me one thing you've learned about yourself this year? So one thing you've learned about, yourself as a person, how you work and things like that this year. And moving forward, how do we continue to carry on the work that we're each individually doing in our respective areas? So I'll start with you, Badru.
Thank you, Gloria. Well, I think I've learned a lot. First of all, I do appreciate and say thanks to the good team that we have. Working as a team has enabled us to provide as many services and as possible, and they're very coordinated in a way that we haven't left any stone unturned. I have also learned to discipline myself to work in isolation. Something that everybody thought, you have to go to the office, you have to talk to so-and-so, but you wake up in the morning, you sit on your computer, you do your work. If you want to consult someone, they're always there. And if you need to work with somebody is always there. The good thing is that here we've got very good Wi-Fi connections and efficient machines, and that we continue to do our outreach online, to do our training online, our community engagement, our testing virtually undisturbed. And also, I've learned the use of new software. I should say new because I never used it before. I had never used Zoom or Teams. Salesforce, I knew it was there, but I never knew the extent of using it to do what we do now. So I think there's been a lot to be gained, to build, to learn. And I'm sure we're going to learn more. And that is really the advantage, or something that I appreciate. Gloria.
Thank you, Badru. Euriza, I know you're relatively new, but moving forward, what are you planning on doing in the next, let's say, few months? And what have you learned about yourself in this short period that you've been working with us?
I'm trying to still just get some discipline, organizing myself while working online, because it's very different for me. So I'm just trying to adapt myself into this new form of working. And also, I think in terms of teamwork, it seems to me that the team is stronger. With the online services, it seems like everyone is more connected, even more connected. And to take forward, I would say just the benefit of the online services is just balance both of them, like face-to-face and the online services, and being able to balance them and move forward to the face-to-face services again. So.
Thank you, Euriza. And Massimo?
So yeah, what I learned about myself, I don't know, that I'm surprised that I'm still sane by myself all this time. So that's something I learned about myself.
So you're resilient then. You're
yeah. I found out that I'm quite resilient. For what I would like to do going forward, well, in the short term, while we are still in this COVID, I would like to enhance our online services as much as possible. And afterwards, as Yasmin said, we found out new clients that weren't accessing our services online, but we also found out how many people has difficulties to access online services. So when we will be able to offer them alternative forms of testing, I would like to work especially about language barriers, which are really important. So having clinics specifically for people who don't speak a good level of English. And I would like also to be able to interact with other people who is not necessarily able to access online services for reasons like chaotic lifestyle, or they're not able to access internet or anything. So being able to engage with these populations as well. And also, I think there are populations even in the LGBTQ community that will that are not necessarily the gay man or men that have sex with men, but like transsexual and non-binary people can also have needs to access our services, and our services, I think, have to be tailored also towards those populations that are not always evidently approached by our services.
Thank you, Massimo. Yasmin?
Yeah, I think the learning I had is never underestimate anyone. I mean, I'll give you an example with the work that Badru did. Just recently, he released an Islamic leaflet, which was like the culmination of a year's work, where he spoke to leading imams across London to actually cultivate interest, to engage that specific Muslim community around HIV. And he did all of that online, and then he launched it online, and now we're getting it translated into community languages. And if you'd have said, create this resource and do it as an online project before, I would have thought that wasn't a possible thing to do. But actually what Badru demonstrated, what you, Gloria, demonstrate with the training that you deliver with the COVID and how you've adapted that to online, is just don't underestimate anyone. Because I think all of us have realized that we are able to exist in this space when perhaps none of us would have chosen these ways of working. I mean, for example, I'm currently, why my Wi-Fi is so bad, I'm currently working out of South Africa, but delivering services in London. So yeah, I would never have thought that were possible.
Thank you, Yasmin. Yeah, I think the final thing for me, what I've learned about myself is patience, I think. Yeah, at some stage I was working at home with a 4-year-old, and sometimes that would get really frustrating. But yeah, patience is one thing I've learned. Perseverance. I feel like as a team we persevere. I feel like some things we've learned along the way, and sometimes we haven't got it the first time, but I feel like every single one of us has demonstrated perseverance. We've continued and asked for help and learned, and until we're all like really good at whatever we do, which makes me really proud to be, you know, part of such a great team. Yeah, and it was strange being a new member of the team, but I am really happy, you know, being part of the team. Moving forward, I think I'd love to just continue the training that we offer. I think it'd be nice to sort of vary the training package that we offer and maybe add new things into it. But yeah, I mean, it's been a different year, let's say. It probably hasn't been the best for everyone, but we've all worked really hard and we're coming towards the end of it. Woo! So yeah, I think it's all about looking to next year, planning about, you know, what we're going to do next year. And yeah, hopefully continuing with Be Live. I've enjoyed also being a part of Technicolor, which is Massimo's fantastic brainchild. And I hope to continue working on, you know, on all of these online platforms. Unless anyone has anything to add, I think that's all from us. Thank you for taking time to listen to us, and yeah, take care and stay safe, everyone. Bye.
Bye.
Thank you.